It's not uncommon to have varied interpretation of an X-ray chest, especially in an ICU. This case is like that. This is X-ray chest of a 50-year-old lady. The questions are whether is it done in PA view or AP view, what are all the findings, especially about the signs, and lastly something is focused with the arrows. What is it, and give your attention. Think about it. I'll give you few more seconds. If you want more time, please pause the video and take your time for your thoughts. Okay, are you ready? Let's go. First of all, whether is it PA or AP view? It's typical PA view. It's due to the presence of spine of the scapula hanging over the clavicles outside the rib cage. This PA view or AP view had been discussed in detail in the 30-second quiz, and that link has been given in the end. If you have not gone through it, please click the link and go through it. Before going to the second and third questions, it's always to have a normal X-ray chest PA view for faster learning and attention. So I'm giving a normal X-ray chest PA view, except that X-ray chest has few fibrotic strands in the apex of right lung and otherwise looking normal. Now we will assess the findings and the signs in our X-ray chest PA view. Before assessment, our X-ray chest is slightly rotated and over-penetrated, which is apparent when we compare to the normal one. It's very easy to say that there is significant cardiomegaly. The hilar vasculatures are not appreciable due to the over-penetration. When we compare with the normal one, there is more bulkiness in the bilateral hilar, usually called as fuzzy hilum. Both the diaphragms are not visualized due to the increased density in the lower zones, obscuring the respective, which is called as positive silhouette sign. Increased density is also noted in bilateral lower zones, but there is somewhat visualization of both the cardiac borders, which is called as some negative silhouette sign. We have discussed about the positive and negative silhouette sign in detail in the 27th quiz of this channel. I am giving the radiology channel link in end of the video, and you can click and then go to the 27th quiz in that link if you need. We'll go to the last question, which is about the line arrowed in the X-ray chest. Yes, it's called as meniscus sign. I think everybody knows, and usually due to free pleural effusion. All the above findings with the ECG and echo interpreted by our cardiologist reveal findings consistent with dilated cardiomyopathy and she underwent conservative management, and the patient was in ICU initially and then was shifted to room side, and within 3 days she was discharged. And after a week she consulted again our cardiologist, and at that time X-ray chest PA view was done, and the cardiologist saw the same meniscus sign in the X-ray chest and sent for ultrasound chest to rule out pleural effusion. And he had also mentioned about the meniscus and asked us to interpret with ultrasound, and ultrasound was done and there was no pleural effusion. And I can see the X-ray chest, it was almost like that, the meniscus sign was there. Is it due to any artifact? Our questions was whether we need CT chest or a repeat X-ray chest. For clarification, because we were clueless, so I went with her to X-ray department to repeat the X-ray chest in my guidance. But the patient was very clever and intelligent, and she sensed our trouble, and she said in soft voice, "Sir, is this the one troubling you?" Her fingers were focusing her right posterolateral chest wall, and there was very softly palpable mass in her back. You can see the picture focusing the soft tissue. She also told this that this has been there for many years, and ultrasound was done on that, focusing there, revealing findings of intramuscular lymphoma. We were ready to do CT chest to confirm it, but she denied to undergo CT scan, and she also refused to undergo surgical resection because she said, "I love to live with it." Now my take-home message in this X-ray chest is, give attention to all the findings in the X-ray chest. Assess whether is it PA view or AP view, whether is it in good inspiratory effort or in expiratory effort, and assess whether it shows normal penetration and is there any rotation. And common signs of meniscus and silhouette sign are very important to interpret: consolidation and pleural effusion. And if there is cardiomegaly, you have to be dealing with pulmonary edema or congestive cardiac failure, and please remember that. And be aware of apparent cardiomegaly, pseudo silhouette sign, pseudomeniscus sign with a pseudomeniscus sign as in this case. After the invention of CT, most of us are not giving attention to interpret any X-ray chest. But if you start giving attention to X-ray chest, within few months, we know most of the CT findings can be easily picked up on our X-ray chest itself because practice gives perfection. Thanks for your attention.